One of the COVID cases that was reported on Thursday had begun experiencing COVID symptoms more than a week before his diagnosis. He had also visited a doctor several times, but was not sent to a hospital for testing. Central Epidemic Command Center Chief Chen Shih-chung said the clinic had been careless for failing to send the patient to be tested since the patient worked at a quarantine hotel. But the Taiwan Primary Care Association says the clinic had no way of knowing that the patient was a high-risk person, as there was no indication of where he worked in his health records.
This clinic in New Taipei's Sanchong district has pulled down the shutters. A sign on the side says it won't reopen until May 11th. That's because case 1120 recently came to see the doctor here. The patient worked in housekeeping at a hotel in Taoyuan where many China Airlines pilots quarantined after returning to Taiwan. The man had no history of foreign travel. His main duties at the hotel were cleaning rooms and buying things for guests. He developed a cough and a runny nose on April 17th and saw a doctor 3 times in 1 week. On April 27th, he was tested for COVID and diagnosed with the disease. Health Minister Chen had previously said the local clinic had failed to notice the case due to inattentiveness. The Taiwan Primary Care Association thinks otherwise.
The workers at quarantine hotels are a very high-risk group. Every day they are with people who may be infected. How come that isn't noted in the health records system? If your records have the note, and I see you have a health problem, I would absolutely send you straight to get tested at a hospital. It's normal for patients with breathing issues to visit the doctor 3 times.
The doctor says clinics can't treat each of their many patients as COVID cases. He says the problem in this case was that workers at quarantine hotels who are at high risk of infection are not listed as such in their NHI card data. This makes it hard for local clinics to see who truly is at risk. In addition, the doctor who attended to patient 1120 said he simply thought it was a cold, as the patient did not reveal his occupation or his contact history.
We need rapid testing tools. It can't be that every time a patient comes in, doctors have to put on PPE, spend 20 minutes collecting a sample, sending it to the CDC, and then waiting 2 days for a result. This is very hard for frontline clinics to do. If quarantine hotel employees don't feel well and don't report it, they unintentionally become a blind spot and vulnerability for epidemic prevention. We need to put our hearts into investigating the matter.
6 pilots who had stayed at the hotel where case number 1120 worked have also been diagnosed with COVID. Contact tracing is still ongoing to prevent the virus from spreading in the community.